And then as we look toward the back part of the brain, that very old brain, the primitive brain, is the cerebellum. And it is mainly in this area of the cerebellum that we see underdevelopment. Now, that's rather interesting because studies now have shown that family members of people who have ADHD was in my family, that when we look at the parents and at the siblings of people with ADHD, we also see underdevelopment in most of these regions, but not in all of them. Which means that this underdevelopment is part of the family phenotype of ADHD. ADHD is a spectrum disorder, and biological relatives of affected patients do show some symptoms of ADHD, but not the full disorder. This is very much like autistic spectrum disorders in that sense, where we see elements of autistic-like symptoms, but not full disorder or diagnosable disorder in those individuals. What has been fascinating has been the work of the UCLA research team, Jim McGough, Jim McCracken, and others, that have shown that when we look at the relatives of people with ADHD, the frontal lobe, the anterior cingulate, the basal ganglia are also smaller, even though the people don't have the disorder. The difference is the cerebellum. The affected patients have the underdevelopment in the cerebellum. The non-affected family members do not, suggesting that the cerebellum may actually be the most crucial structure in explaining why the disorder rises to full disorder, penetrating the phenotype and becoming diagnosable ADHD.